terms of the plasma concentration study, what we did was we looked at a post-hoc analysis of a study that was done, a safety and pharmacokinetics study that was done for cenobamate. In the original study, there were 1,347 patients from the United States and around the world. 1,340 patients received cenobamate in that study. However, it was not done for efficacy. It was done originally for safety and pharmacokinetics. So we decided that we knew that many of the sites would have good seizure data because they keep seizure calendars. So we went back and got approval from, in terms of getting new consents, et cetera, for the patients, and got approval for the study. And we looked at the sites in the United States who had entered 11 or more patients, and 11 or more patients who had actually received cenobamate. There were 12 centers originally. 10 centers were able to give us data and be able to participate. And of those 10 centers, there were 240 patients. What we did during the study was that patients were allowed to, or were to get a level for cenobamate at the end of titration, so at the end of 12 weeks, and also 2 weeks later. And what we found was, at that time, during titration, patients were being slowly increased, starting at 12.5 milligrams per day. Every 2 weeks went 12.5, 25, then 50, then 100, 150, and 200 milligrams. At the end of titration, they were at 200 milligrams. We got blood levels for them, and the range came out in basically in 11 to 19 micrograms per milliliter. And that's essentially where the levels, they came out with a mean of approximately 14 to 15 mics per ml. The reason that that's important is that, you know, many pharmaceutical companies now often talk about levels sometimes that you don't need to get and obtain, et cetera. But we as neurologists and epileptologists find it's extremely important in terms of compliance, knowing that the patients are taking their medicine. So what we found was this was consistent from the post-hoc analysis with the early C013 and C017 studies, again, came out in the 11 to 19 microgram per milliliter range. In the earlier study, when they had a titration where they were looking at 100, 200, and 400, what they found was basically that patients at 100 milligrams would be in the 5 to 9 or 10 mic per ml range. Patients who were in the 400 milligram range could go up to about 35 mics per ml. So it basically, while there's no set therapeutic range, we know that levels between 100 and 400 milligrams will probably be somewhere between 5 mics per ml and 35, and patients taking 200 milligrams per day will be in the patients taking 200 milligrams per ml will be in the 11 to 19 mics per ml range. That will help physicians. Now remember, this is not at their final, whether they were seizure-free or et cetera. We did look at 50% and 100% reduction in seizures. However, at those two visits, they were all basically in the 14 to 15 mic per ml as a mean. Perhaps slightly lower for those who got 100% seizure-free. However, the important part is that in real life, you'll probably also get levels when they attain the seizure freedom, et cetera, and know what their level is at that point. This study was not done for that purpose. It was just simply to see what levels were at 200. Many of the patients ended up, especially those that were seizure-free, 225 to 255 milligrams a day. So levels might be a little bit higher at that dosage.